Good morning, everyone. Happy Tuesday. This webinar today is about to get started, and I'll do an intro in just a minute. Let me get some more people to join, and then we'll get started in just a few seconds. All right, we're going to get started here. My name is Kara Highfill. I'm with the Illinois Restaurant Association. Thank you for joining, everyone, and thanks for being here. Today's webinar is on health and wellness and support for restaurant workers. During today's webinar, we'll hear from Healthy Hospitality, and we will also have on today's webinar, it is in broadcast in English, Spanish, and Mandarin Chinese. So if you would like to use those interpretation services, please use the interpretation button at the bottom of your toolbar there. This webinar is also being presented in conjunction with the Cook County Small Business Source. And here at the IRA, we are a partner with the Cook County Small Business Source, which was established initially to help businesses, especially restaurants that have been hit hard during the pandemic. And we're doing everything we can, like webinars like this, to ensure that restaurants and hospitality industries come out of the pandemic intact and ready for growth. This is one of the many services we offer here at this webinar. We also have one-on-one business advising. We do roundtables. We do different type of events throughout the county. We have grants and other events that we can make sure to help every business that needs a position to growth after the past 3 years that have been really tough. For one-on-one business advising, you can sign up at cookcountysmallbiz.org. It's free, it's simple, and it's really easy to sign up. And there's a great resource, and you can get one-on-one business advising. We do it all the time. Also, all of this contact information for Healthy Hospitality and our contact information here at the Illinois Restaurant Association will be sent out after the webinar, and it'll be posted on our website, illinoisrestaurants.org. Myself here at the Illinois Restaurant Association and all of our partners with the Cook County Small Business Source remain as a resource to you. So please feel free to reach out if you have any questions about your current business or would like some more resources. We remain dedicated to helping everyone in the hospitality industry. Before we get started, I want to remind everyone that you can type in questions in the Q&A chat box thing. So if you just type those in, we'll answer those at the end of the presentation, and I will try to get to all those as best as possible. If you see a question in the chat box that you particularly like, just give it a thumbs up so we can make sure to prioritize those. Now, without further ado, I would like to introduce our panelists today. Kimberly Vandervoorn, she is with United Health Group, and she will be presenting with Healthy Hospitality today. Kimberly, take it away.
Hello, everybody, and Kara, Teresa, and Illinois Restaurant Association, thank you so much for having me today, and I'm looking forward to talking about all the fabulous resources that we have created for hospitality. So Healthy Hospitality is a brand that I created, and it's a platform for offering curated wellness solutions that are exclusive and unique and specifically negotiated on behalf of the hospitality industry. And you can go to the next slide, please. So when we, in creating this platform of solutions, what I really take to heart is the World Health Organization's definition of wellness. And we all kind of know it's physical wellness, it's mental wellness, but then it's also social wellness. This is something that really became impactful during the pandemic. And so this suite of solutions is intended to make sure that there are meaningful, accessible, convenient, and affordable wellness solutions, social wellness, mental wellness, and physical wellness for absolutely every person in hospitality. And our goal is to make sure, to do everything we can to make sure that no one suffers alone. And there's a heck of a lot of suffering going on out there. And we have the resources. We need to get them out to people. So you can keep going. Thank you. So just a couple of data points. I've got a handful of slides with a bunch of data points. And so if you're on this webinar, you probably know this already, but I think it's always good to ground ourselves in the data. And so 74% of healthy employees, holistically healthy, are more likely to be satisfied with their job. And then I'll hit you with a few more data points on the next few slides so you can keep going. 51% are more likely to be at their organization in 12 months. So, and we can just keep going here. 53% are likely to be more productive. And I think we probably all know now, 9 out of 10 employees say that health insurance is a must-have. So I think we all know at this point that company culture matters, and you don't have to, as an employer, you don't have to spend a small fortune on employer-sponsored health insurance to create a culture of wellness. We've created the solutions for you so you don't have to break the bank, and you can help every single person in your organization, because we know that the lifeblood of hospitality is in large part, part-timers and seasonal folks, and we need to be able to help every single person, not just full-timers, which comprise obviously a very small portion of the of folks who work in hospitality. Okay, so we know that it matters, and we know that everyone's talking about DE&I, diversity, equity, and inclusion. And the fact is that workers are they're actively seeking employers who show that they have some manner of commitment to diversity, equity, and inclusion. And so these resources help you do that, because they are truly they are for everyone. There's something for everyone, regardless of whether those folks have transportation or childcare or money for gas, or live in a very rural community. There is something for everyone, regardless of where they live and what their socioeconomic level is. And so these solutions, I think, are the very definition of DE&I, and so will help you provide opportunity for everyone who works on your team. Next slide, please. Of course, we probably all know at this point that there is a very strong business case for offering wellness solutions and to employers that show in a meaningful, tangible way that they care about their team and their team's wellness. It pays for itself over and over and over again, and with a high cost of turnover, the high cost of absenteeism and turnover, and lack of productivity, and on and on and on. These sort of programs help incentivize people to come back to work, and then come back to work for hospitality and not, Target and Best Buy retail. But then also, how do you get people to come back to work for you and not another hospitality employer up the street? Even if you're a very, very small business and you cannot afford to buy health benefits for your team, these are all very tangible and meaningful ways that will help you attract and retain talent. And even, I thought this was pretty interesting. Healthy employees are, not only are they happy employees, but which yield happy customers, but healthier employees, this is a very interesting data point to me, are in a very tangible way create a healthier workplace, in that workplace violence is reduced. And so if you talk to, and I've heard this time and time again from workers' comp carriers and brokers, and that is that healthier people that have access to mental health resources are able to manage their anger and frustration and burnout. We're all burnt out from the pandemic. How do we channel that? And so workers' comp our program the evidence shows that it reduces workers' comp claims, which I think is very interesting. Peer-to-peer conflicts, customer to employee conflicts, which are all over the place because I don't know why, but people have just become jerks after the pandemic. I mean, you'd think that they would be kinder and gentler with with folks who work in hospitality, but oddly enough, they're not. And so it's the frontline folks in hospitality that have to deal with this all the time. So these resources will help you help your team be present, be productive, stay with you, be loyal. So let's go to the next slide, please. Okay, so here's our suite of curated solutions, and there is everything from employer-sponsored health benefits to we've got. I just finished negotiating a deal with Care.com, and that's under the social wellness heading, and we're going to be launching that in about 4 weeks. So that's super exciting that hospitality employers will be able to give their team access to care resources, adult care, child care, even pet care. So these are all mutually exclusive solutions. That means you can select one or all or two or three. Any of these are available to you. You can pick and choose. The beauty of this suite of solutions is you can pick and choose what works for you, and we will happily help you do that depending on your the needs of your business, the needs of your team, the component, the makeup of your workforce and your team, and the nature of your business and all that stuff. So we're happy to help you figure out the most affordable, comprehensive, and meaningful resources that work best for you and your business. Okay, so the first thing I'm going to talk about is our partnership with United Healthcare, and that this is for any hospitality businesses that are able to have the profit margin and are able to offer employer-sponsored health benefits to your team. Of course, this is only your full-timers will ever be able to be eligible for employer-sponsored health benefits. So this partnership is great for helping your full-timers, but we also know that really the vast majority of employers in the hospitality industry, really it's untenable for you to be able to purchase health benefits for your team because they're extraordinarily expensive, and it's hard, especially for small businesses, to be able to navigate the cost, the participation requirements, the contributions, all that stuff. Excuse me, it's just very costly, especially for small businesses. But if you own a business or you manage a business and you can, or you're looking to offer health benefits to your team that are sponsored by you as the employer, get your United Healthcare IRA member quote. It's you have access to discounts as a member, members only discounts on medical, and then on particularly on what we call specialty products, which are dental insurance, vision, life insurance, disability, critical illness. Those are very, very, very inexpensive. You could, if you can't afford to offer medical benefits, maybe you look into getting an IRA member quote for just dental, which is so inexpensive, it's practically free. You're looking at like $10 a month or something for each team member. So get a quote. It's never going to be the right solution for everyone, but there are discounts that are unique to IRA members. And if you are looking to do that, we've got a phenomenal United Healthcare team. Mike Teleski will help you, and his team is amazing, and they're just incredible partners. So United Healthcare has always demonstrated a very, very strong commitment to hospitality and helping as many people as we can through the Illinois Restaurant Association. So encourage you to get your member quote if that's something that you can afford and works for you. Next slide, please. So United Healthcare and or employer sponsored benefits, if you can afford to offer them, fabulous. They will help your full timers. What about everybody else? So our partnership with Teladoc is amazing. I am so proud of this sponsorship. I mean, of this partnership. This is something that if you've never had a virtual visit, I would encourage you to try it. It's where healthcare is going to be all virtual pretty much at some point. Virtual visits are incredible. And I think one of the most compelling aspects of this program, our partnership with Teladoc, is that it's sort of the great equalizer when it comes to like this is the definition of DE&I right here in my mind. This allows us to help every single person. There is no one that is excluded from this service. As long as you live in the United States, you don't even need to be documented. But if this is available to anyone in the United States. And so this is, it's extraordinary. And the biggest problem with this is that it seems like it's too good to be true, but it is true. And I use it, and my family uses it, and my adult kids use it, and we all use this. It is amazing. And here's what it is. It costs you $9 a month for one person, for one employee. And that $9 a month includes that employee plus that employee's entire household. And it doesn't have to be dependents. It's just household. And that can be 5 people or 2 people or 10 people. Nobody asks, nobody cares. So it's extraordinary. And $9 a month is where it starts and where it ends. There are no co-payments. There are no hidden fees. There are no hidden costs. It's $9 a month. And what that $9 gets your team member and that team member's entire household, unlimited care. And that is unlimited general medical care, which keeps people out of the emergency room. Hospitality workers go to the emergency room. They wait till they're really, really sick. And it's a part a scheduling issue. It's tough. Plus, most of them do not have insurance. So what are they going to do? They don't want to spend the money. They don't want to spend the time. Maybe they don't have transportation, and they wait till they're very, very sick and they go to the emergency room, which they cannot afford. And by the time they get there, they've probably already quit their job, or they completely lack productivity. They show up, presenteeism. They show up for work, but they are not really there. They're not really able to be productive because they're not well. So this removes any excuse not to get medical care. The general medical component is available 24 hours a day, 7 days a week. So you've got a sick child at 3:00 in the morning, you log on to Healthiest You app by Teladoc. Within probably 2 or 3 minutes, you're on a video chat with a doctor and you're getting the care you need. If you're sick in the middle of the night, you have a sick child, Sunday afternoon, whatever that might be, urgent care is closed. And this Healthiest You by Teladoc can resolve about 99% of the issues that cause people to go to the emergency room. So unless you physically have to have someone's hands on you, this solution can resolve anything. Although the largest reasons that people go to the ER, they're not emergency room type situations. So general medical, incredible. Important to note that Teladoc clinicians are all licensed in the United States. They are real working doctors. So they're not retired people who are just tired of working, out there in brick and mortar. And so they're deciding to do this. They're not. Most of the general medical folks that you'll get, a lot of them are actually emergency room physicians. They're they're practicing physicians. And so their Teladoc doctors can diagnose, they can create treatment plans and prescribe medication. So I've seen time and time again, I use this all the time. My adult son uses this for his toddler. You know, you call and you're, if there's a prescription needed, you're at the pharmacy within 10 minutes picking it up. It's amazing. It's amazing. And I think what's so incredible about it is that it doesn't matter who you are or where you live or what your resources are. You get the same, a frontline hospitality worker who doesn't have a car and is a low wage earner who lives in a rural county, has the access to the very same gold star physicians that someone who works on Wall Street who makes millions of dollars a year has access to. It's the same equal rights when it comes to getting access to gold standard treatment. So that's general medical. The mental health component of this program, most virtual care programs do not include mental health. And so when I was putting this program together, it was critical to me that it includes mental health care, because there are so many people suffering just across the population. I think we're up to, we are up to over 100,000 overdoses in a 12-month period of time for the first time in history. Over 100,000 overdoses in 12 months. The overdosing mental health crisis is real. And this is something that we need to make sure everybody has access to. The mental health component to this is extraordinary. Unlimited access to mental health care. $9 a month. There's no copayment. There's no anything. I have a psychiatrist on Teladoc. I have a mental health therapist on Teladoc, which I desperately needed in COVID. When I signed up for this, within 7 days, I had an appointment with a Teladoc psychiatrist, a Teladoc therapist in my county, licensed in my county, in my state. And this is saving lives, because if people need mental health care, it's taking 8 months, 7, 8, 9 months to even get in to see a psychiatrist. Not to mention the fact that no one can afford it, and you're not going to do it. And once you wait 5, 6, 7, 8 months, you're not in crisis anymore. You don't even remember why you made the appointment. So this is saving lives. This is changing lives, and it's so important to get this out there to people. So the mental health component is extraordinary. You go on the app, you select your zip code, and it gives you a whole listing of practitioners, of clinicians that are licensed in your county, in your state. And you can go through and you can see their photograph, you can see their focus areas, their education, the things that they're passionate about, and that you can pick one and you try that person. And if you like that person, you stay with that person. And you just develop a treatment plan. And if they say they want to meet with you 5 times a week or 5 times a month or 5 times a year, you set that up with that person, and it's never any more. It doesn't cost any more. It's $9 a month. It's incredible. The other thing to keep in mind when I was working on this partnership, I was astonished to learn that 65%, almost 70% of counties in the United States do not have one single licensed psychiatrist. It's almost 70% of counties in our country. That is that blows my mind. So resources like this are so important, and they're so impactful. And I feel strongly that those of us who are in a position of leadership and in a position to help we need to do it. And this resource exists, and we need to get it out to people. So, okay. So again, $9 a month for a person plus that person's household, unlimited general medical, unlimited mental health care with medication, all that stuff. The other things which are compelling also, dermatology. And you might think, how in the world is virtual dermatology even a thing? And it's amazing. I have used this for infected wasp bites, for rashes. My son uses it for his baby because he's got eczema and some weird skin issues. And you just simply take several photographs, upload it to the app. They look at it. The dermatologists look at the photographs, and if you've got something like a toddler that has a certain rash, they diagnose it, they identify it, and then they prescribe medication, because they can tell what it is. They can tell as easily from a photograph as they can by looking at it in person. And it's just an extraordinary resource. So also there's physical therapy, and speaking to the opioid addiction crisis and overdose crisis, we need to give people the ability to stay off opioids and not to go down that path if they have an injury. And we know that the hospitality industry is rife with musculoskeletal injuries, and most of us walking around have those types of injuries. Well, let's make sure people get access to physical therapy. So that is what this is. Again, this is available to full-timers, part-timers, seasonal, H-2B, 1099, even undocumented workers, everyone. So this is incredible. If you do nothing else, please look at this. Please look at getting this for every one of your team members, even full-timers that have access to health insurance. Usually we all have some component of virtual care in our health insurance package. But I know I'm one of the very lucky people in the world. I have a good job. I have health insurance. I have a virtual visit component to mine, but it stinks, really. It doesn't, there's no mental health care. I have a huge copayment. So I don't use that. I use this. I have this solution because it's comprehensive. It takes care of everything I could possibly need. And I never go to the doctor anymore. I use Teladoc for absolutely everything, regardless of what it is. So this is incredible. Please consider getting this for your team. And we'll make you as the employer just look like heroes. We have materials that we can make for you. We've got them all ready to go. We can put your logo on them if you choose to purchase this for your team. Also, if you're an employer that can offer health benefits to your team, you're looking to control medical costs. If you offer a self-funded plan, for example, or a fully insured plan, you need to control your medical costs. You need to control your claim costs, because that is what drives your increases every year through your insurance carrier. This is the way to do that, because there are no claims involved. This is completely outside of your insurance. This is amazing. So please call me. Please ask questions. Please look at this, and please don't dismiss it as being something that's too good to be true and thinking there's a catch, because there is no catch. There is no catch. This is a gift from Teladoc leadership team to hospitality. And I'm happy to go through the financial piece of it and how this works for Teladoc. Call me and we'll do that. Okay. So this other solution is something that I hope everyone considers. This is something that is free to employers, no employer commitment whatsoever. And so this is for all of your team members who do not have access to employer-sponsored health benefits. So if you're a smaller employer and you do not offer health benefits, this is for every single one of your team members. If you are an employer who does offer health benefits, again, that's only going to be available or relevant to your full-timers. So what about everybody else who actually wants to get health insurance for themselves? If you're a small business, it's going to be extremely costly. You've got challenges with employer-sponsored health benefits, with um, um, participation and all that stuff. It's very, very difficult. So consider this instead. This is simply something that you pass through to your team as an employer. You do nothing. You do nothing. This is an incredible service. So here's what it is. Oh, by the way, Teladoc is available and supports something like 247 different languages, in case you were wondering. So sorry, I forgot to mention that. So this individual and family health insurance service also supports over 200 languages. Now you have to be documented to use this service. That's the only eligibility requirement. You could work 1 hour a week, or you don't even, or 50 hours a week, or 80 hours a week, or you don't even need to be working. So this service is designed to make sure that your team gets help, really, and gets access to the maximum federal subsidies to which they're entitled, the lowest, the most affordably priced health benefit plans that meet the needs of the individual and their family, and to remove the kind of hair on fire that people have to go through if they go through healthcare.gov or some other system like that, which is nearly impossible for anyone to navigate. It's unbelievably confusing, and if you're able to navigate it, you're still not going to. You have to be some sort of expert to make sure you're getting your maximum federal subsidy and all those things. So this service removes all of that, all of those questions, the confusion, the frustration. And again, employers, all you need to do is post something on your staff, in your staff area, hand this out. It's nothing that employers have to do. So here's the service. Let's say I work for someone who's on this webinar. I call this number. It's a dedicated line for the Illinois Restaurant Association. I call the number. The person on the other end of the phone is a licensed representative who will ask me questions about my needs, my family's needs. What are we looking for? That person will then physically pull quotes from any carrier that offers individual and family health insurance in my county. So this is not a United Healthcare program. This is a multi-carrier, carrier agnostic program that will give me the best solutions in my county and my state. So it could be, Blue Cross, quotes from Blue Cross, Aetna, Cigna, United Healthcare, whomever, whatever plans seem to work best for me and my family. So the licensed rep will pull these quotes, will walk me through, kind of provide guidance for me. Can you go to the next slide, please? What these plans mean to me, because it is so darn confusing to people. So what are my needs? How do these quotes, what's the difference between these quotes? They'll make sure I get the access to the most reasonably priced quotes that meet my needs and my family's needs. Also, we'll make sure I get my maximum, the absolute maximum in federal dollars that I possibly can get. And this is really important because the feds have increased the federal subsidies exponentially. So 4 out of 5 people who are getting individual and family insurance now are getting individual and family insurance for about $10 a month, because the subsidies are that high. And we're talking about Affordable Care Act compliant plans. We're talking about, minimum essential coverage. These are federally approved plans that are great plans. They're just incredibly heavily subsidized at this point. And so hospitality workers, lower wage earners, a lot of them are getting fully subsidized plans. So they're not paying anything. And again, 4 out of 5 are paying $10 a month. So this is an extraordinary program. Finally, I think probably the best part of this whole thing is that the licensed rep on the phone can enroll me and my family over the phone. So there's no confusion. There's no frustration. I get it explained to me. I get quotes pulled for me. I get the maximum federal subsidy, and I get enrolled over the phone. Done. It's amazing. And this service is free. It's completely free service. The only thing that your employee needs to pay for, or you, if you're a small business owner, you're welcome to use this service. The only thing you pay for is actually the coverage that you select. Again, for most people, that's $10 a month. It's amazing. So open enrollment is now. The feds mandate that there is a period of time every year during which anyone can apply and get individual and family health insurance. The feds dictate that time period. This year it is November 1st to January 15th. And so this is the time to be making sure your team knows about this. Next slide, please. And again, we make it so easy for you to pass this along to your team. We've got a flyer that we are happy. If you send me your logo, we're happy to put your logo on it, make you as the employer look like the hero here that you're bringing in this program, along with the Illinois Restaurant Association. We have an English flyer and we have a Spanish flyer. If there are any other language needs, we're happy to pay for a translation service to make sure you get what you need to support your team. But for right now, we've got English, we've got Spanish. We're working on a Korean translation and also a Creole translation. So please let us know if you need other translations. But again, employers, this is easy. Just IRA has them somewhere on their website, I believe, or we'll attach these to an email. All you need to do is print them and post them in a staff area, or print them and hand them out. That's all you need to do. Employers need to do nothing other than that. Again, if you want your logo on them, send it to me. Happy to do it for you. This is an amazing service. And then we've got just a variety of other free offerings. One is a pharmacy discount program that can save your team up to 80% on any prescriptions. So this is something that we know that prescription discount programs are sort of a dime a dozen, but we wanted to make sure that you have one, that the hospitality industry has one to use in case you don't have a different one. So this is accepted at virtually every pharmacy across the country except for Kaiser. And it's there to the extent that you want to use it, and we're happy to give you materials on that as well. Next slide, please. We also have a whole variety of free mental health resources. We did a research and development initiative several years ago, focused on the mental health, suicide, and substance use disorder crisis in hospitality. And amazing data. We've got incredible data that we've turned into a free guidebook for managers, just very easy things that anyone can do any day to kind of change, turn the tide, stem the tide, and create a healthier workplace. Easy, free things this is coming directly from the mouths of folks who work in hospitality. And there are things that everyone can do. We've also got a resource sheet that we're happy to send you. It's probably on the IRA's website, I would imagine. You can download it. We just refreshed this one, IRA friends. So we want to make sure that the new one's on your website. But this is a bunch of resources that are, they're free, they're crisis lines, they're everything from crisis lines to free health and wellness resources to even free apps that will help with sleep and things like that. So just if you want to just print these out and post them, it's just one more thing you can do to help your team. Okay, and then really quickly, so that we have time for questions, as I said when we started out, all of these different resources can be packaged in meaningful ways for different businesses, depending on what your business looks like, what your needs are, what your budget is. Do you not even have a budget for this stuff? That's okay. We can help you with that. There's something for everyone. And whether you're a small business, you can keep going, please. If you're a small business, next slide, please. If you're a small business, as I indicated early on, most small businesses just can't really afford employer-sponsored benefits. So what do? Easy. You pass along the individual and family service so that folks get insurance, and they're going to be paying almost nothing compared to what they would have to pay if you offered employer-sponsored health benefits, because they have to pay half of the premium, which is in most cases not affordable. So individual and family option is the way to go. Pass it on, pass it through, and then get everyone Teladoc. I mean, that is your recipe for success as a small employer, and we will help you get there. If you're a medium-sized employer, also, give us a call. We'll help you walk through what your needs are. If you offer health insurance or in a position to think about it, by all means, ask your broker. Work with Mike Telesky and his team. Ask your broker for your IRA member United Healthcare quote. If that works for you, that's great. If it doesn't work for you, still offer individual and family insurance to the service. Pass it on to your team, to your part-timers, and then get everyone Teladoc. And everyone should be getting access to the free suite of mental health resources, the crisis lines, all of those different things. And then as a large business, you're much more likely to have a self-insured plan where you have the risk for claims. So Teladoc, getting everyone on your team Teladoc for $9 a month is critical to help you control your claim costs and your medical costs. Pass along individual and family, our service for all of your non-full-timers. And there you go. You're taking care of absolutely everyone, and you're including everyone in your attempt to, you're making sure that everybody has access to something. And that's so important, not only from a humanity standpoint, but also from a business, your bottom line as a business owner standpoint. It helps, it helps you, it helps your bottom line to make sure you've got healthy employees. Next slide, please. Next slide, please. And so again, we will, anything you want to, work with us, give us a call. We'll help you figure out what works best for you. And then when you do, we'll create materials for you. We want to make it so easy for you as the employer to explain these solutions to your team. We know that you're incredibly busy and you don't have the time or the desire to be an expert in any of these solutions. So we make it easy for you. If you are a larger business and you've got different, maybe you have some digital channels through which you communicate with your team, we'll create materials for you. We'll create a digital, something digital to pass along the individual and family service, or to explain Teladoc and how do you here are the steps you need to take. Download this app, then wait 2 days, then enroll yourself. Then here's what you're going to see. Then enroll your household. We want to make it super easy to help you engage your team in whatever way you choose to communicate with your team. Some hospitality employers love paycheck stuffers because they still give out paper paychecks. We'll make paycheck stuffers for you. Some folks only communicate digitally through a portal or something. We'll help you with that. Some employers will communicate via email. Some would never communicate via email. Some only communicate via text. Some would never communicate via text. We will fit into how you do business, and we'll help you communicate. We'll give you the tools that you need to communicate these solutions to your prospects when you're interviewing them, in your onboarding materials, in your staff areas, with your current team, with your prospects, all of that. We're happy to do that. We're happy to create personalized branded materials for you. And we're generally just here to help. That's why we're here. We're here to make sure that everyone has access to some meaningful health and wellness solutions. And I think that brings us to the end. And that is my fabulous team.
Oh, wow.
Dreams right there.
I love it. Well, thank you so much, Kimberly. That was super informative. And as you mentioned, some of it sounds honestly so good to be true. I think a lot of people, employers and employees, find the healthcare space confusing, intimidating, hard to approach, which plan to pick, which, how to navigate the different networks that you may or may not be in. So let's get to a few questions before we wrap up here. So do you need to use like United Healthcare in order to use Teladoc, for example?
Great question. No, not at all. So if you go back to, or if you think about our sort of umbrella with all the different solutions and product partners, as I call them, under the umbrella, they're all mutually exclusive. So you don't have to use one to use the other. United Healthcare has nothing to do with Teladoc, which has nothing to do with care.com, which has nothing to do with our individual and family service. You can select one or all. And so, no, United Healthcare is a phenomenal partner, but has nothing to do with the other offerings.
Wow. Like, and this Teladoc specifically, I think here at the IRA, we're all going to sign up because I remember first when you guys sent over all those very helpful materials, I was like, this has to be too good to be true. So yeah. How does that work as a model? How is that affordable to be able to provide?
Yes. So how can Teladoc do this? Why are they doing this? Yes, I get that question all the time. And so it does sound way too good to be true. And again, I use this. I've gotten this for everybody. My team uses it. My mother uses it. My aunt uses it. My neighbors use it. My adult sons and their spouses use it. Everybody I know uses it. It's phenomenal. How is it financially viable? That's the question. So Teladoc, when I went to Teladoc and asked them if they would be interested in offering something meaningful and different and unique for hospitality, they stepped up and they created something at a price point that nobody else gets and nobody else has access to it. And the way they are able to do it, so let's call it what it is, they don't make any money from this program. It's impossible. You can go through the kind of the model of virtual care, which is certainly true and compelling. So obviously there's no brick and mortar expense. There's the economies of scale and all that stuff. But really $9 a month, including, a whole household, how do they make money? They don't. So where do they make their money? Teladoc works with pretty much every insurance carrier in the world. And so let's just take Blue Cross or Aetna or Cigna or United Healthcare. They all work with Teladoc. And when they sell an insurance plan to an employer, that will be embedded with a Teladoc offering. Like I was saying to you, I have United Healthcare, the great benefits. I have a virtual visit component, but it's like a standard virtual visit program, which does not include mental health care, does not include any of the other great stuff that ours does. But that is how Teladoc makes its money from the carriers, because insurance carriers will pay Teladoc untold millions and millions of dollars to be able to embed that service in their benefit plans. So that's a simplification, but that in a nutshell is how Teladoc makes its money. They are doing this because they care about the hospitality industry and they want to be good partners. They want to do something for hospitality in consideration of how important the hospitality industry is to all of us and, in our communities. And, really just, they want to do something unique to help, particularly during the pandemic. Does that mean this is going away when the pandemic is over? No, this is because that was the other stipulation that they made when we were looking to partner. is this isn't a bait and switch type situation wherein you sign your team up for $9 a month and next year it goes up to $30 a month. No, it's not. That is not the case. So I don't know if that answers your question, and I'm happy to get into that more. If anybody wants to call me, I could talk about stuff all day long because it's amazing. So what other
Yeah.
questions?
Thank you so much, Kimberly. And I think you touched on it earlier. That does answer my question. But like you said, it just sounds so great. I can't wait to
Yeah.
sign up everyone in my household. And particularly the mental health piece, because it's so hard to get a doctor now because people didn't go to the doctor for years if they didn't absolutely need to. And so that's backed up, let alone any mental health services, which I think is underutilized because of the barriers to entry there.
Yeah. Yep.
So that's really great to hear. I have a question for on the individual and family insurance services. What is the employer's contribution or commitment with that plan, or does it vary?
So employers, another great question. Employers have zero commitment, nothing at all. All they need to do is pass it along, just raise awareness. And like, as I said before, we make it so easy. Just print these flyers out and post them where your staff can see them. Employers need to do nothing. There's no commitment. There's no money involved. There's nothing. It's just passing it along as a service to your team.
Great. And I think you make a really good point that I can attest to of how easy Healthy Hospitality makes it. There's already marketing materials. You can add your restaurant's logo to it. We've done that with the IRA, added our logos, and everything is very accessible, just like the slideshow, which we will be sending out to everyone. But I had not considered how you could use those materials as an onboarding or part of an interview process, because when staffing is so hard to find these days, that's a great incentive. I bet that's a really good way to recruit people and maintain people when it's so easy to access. Great.
Exactly.
Well, this has been super informative. I feel less intimidated by the healthcare space in general after this. So I just want to remind everyone that you will be getting all these materials, this recording, the slide deck. You'll be sent out in an email, and it'll also be on our website, illinoisrestaurants.org. I also want to thank Kimberly for your time today and this great presentation. And also like to thank the Cook County Small Business Source, which allows us to put on events and webinars like this so we can help bolster up the hospitality industry after a rough few years. And we will continue to have events like these. We have more webinars coming up this year, next year, one-on-one business advising. So please reach out if you have any questions about this or any other way that we can help your restaurant. And I hope everyone has a good Tuesday and a good Thanksgiving.
Thank
Bye,
you.
everyone. Thanks, Kimberly.